Everyone, a rare case of monkeypox has been reported in a Massachusetts man. We want to listen now to Paul Bittinger from Mass General Hospital, where that man is in good condition.
And Dr. Severity Sanchez from the Boston Public Health Commission. And we're here tonight. Earlier, as you received notice from the Massachusetts Department of Public Health, there's a patient in the Commonwealth of Massachusetts who has been confirmed to have infection with monkeypox. That patient is currently hospitalized at Massachusetts General Hospital and is admitted to our special pathogens program. He is in stable condition, and Dr. Shenoy will let you know additional details. Massachusetts General Hospital is the designated regional emerging special pathogens treatment center for the New England area for the 6 states, and the patient is doing well safely in isolation in our unit. I'm going to turn it over to Dr. Shenoy, who will give you additional details.
Thank you. So I'll just give a broad overview of the patient's admission so far. So the patient was admitted on the 12th. They were being evaluated for various symptoms. During the course of their admission, they were identified as a possible monkeypox suspect. And this was really unusual because the patient had no travel history, no exposure to animals that would be known to be reservoirs. However, the team, thinking about the patient and hearing just over the weekend about some of the cases in the United Kingdom, thought more broadly about the patient's diagnosis. When they did that, they communicated that directly to myself. We communicated with the public health authorities. We assembled the team. As Dr. Bittinger mentioned, we have a regional emerging special pathogens treatment center, so we are planned to respond to these sorts of events. We transferred the patient throughout the course of the day to our special pathogens unit, where they've remained. We are in the process, as you can imagine, of working with public health authorities on contact tracing of our employees, of patients, and of visitors, and that's going to continue over the course of the next several days. I will turn it over to my colleague, Dr. Sanchez.
Good evening. I'm Dr. Severity Sanchez. I'm the Medical Director for the Infectious Disease Bureau at the Boston Public Health Commission. The Boston Public Health Commission will continue to collaborate closely with the Massachusetts Department of Public Health, Mass General Brigham, and other healthcare institutions to assist in follow-up of any exposed Boston residents and healthcare workers. In the meantime, and as we learn more, we urge healthcare providers, particularly those in outpatient settings, to remain vigilant to potential cases and to take any necessary precautions, including standard precautions, as well as use of necessary personal protective equipment. That can include gown, gloves, a medical face mask or respirator, and eye protection to minimize exposures. Thank you.
Questions?
Could you talk about exactly what monkeypox is and also just how rare this is?
Yeah, so you had it correct. It is a rare infection, originally identified in the 1950s in monkeys, and then the first human case in 1970. Most of the cases have been reported really out of West Africa or Central Africa. The cases that have been outside of that area have been reported to be related to travel or to animals. I mentioned rodents. Well, there was an outbreak in the United States in 2003 involving many states, and that was associated with prairie dogs. In the last year, there have been 2 cases in the United States in November and then in July. Both of those were associated with travel. And I think that's a really important piece about this, that the epidemiology over the course of the last week or so, several days, it's becoming clearer that is shifting. And so there's a new epidemiology to be considered. And Dr. Sanchez was very clear about being vigilant. And this afternoon, the MDPH released some guidance for clinicians of the things to look for, both clinical symptoms and risk factors. So I really urge clinicians out there to take a look at that and be prepared.
But how do we think this person got it?
So that's something that I'm not sure if public health authorities want to comment on, but there are some known risk factors that have been identified in this population so far. And this is just coming out right now in terms of what the United Kingdom has identified and what has been released by public health authorities. And the risk factor here has been men having sex with men, and so that's sort of close contact. And that makes sense because the way this is spread is through both respiratory droplets with very close proximity, face-to-face respiratory droplets, but also direct contact with the lesions that have virus in them.
Can you talk to us about what you know so far about just how contagious this is, or what we know and what we don't know? And like you said, this patient's in isolation. situation. Just talk about that a little bit.
Yeah, so the patient was placed in an airborne infection isolation room in our special pathogens unit. We're using gowns, gloves, and 95 respirators and eye protection. And this is personal protective equipment that our staff are very familiar with. This is same personal protective equipment that we use when we take care of patients at risk for COVID. It's more than just PPE. It's how you use PPE and the procedures that our team is well versed in, and obviously got extra just-in-time education when the patient was brought to the unit. In terms of how contagious it is, we're learning, as we will continue to learn every day. We really do think, at least our understanding and talking with our public health colleagues who are really they're experts because they have been involved in all the U.S. cases so far, really about close, sustained contact. Now, as we do our contact tracing, we're going to be applying a much broader, more encompassing definition as we do this, and that's really out of an abundance of precaution and applying a methodological approach to assessing risk and following patients over the course of the incubation period.
Just as a point of clarification, you said that this patient did not have history of travel. We saw that it was travel to Canada.
Great
and
point.
Also, where is this patient from? Are they a Boston resident?
Great. So I think Dr. Bittinger mentioned that they are a Boston resident. Now the travel, what I meant, that's a great question. I meant travel to an area where monkeypox is known to be endemic, and that would be West Africa. Now, the patient did have a travel history, but that travel really wasn't anything to be specific for monkeypox.
So there's outbreaks or there's clusters in the UK right now, and in Canada, are there any that you're aware of? And are you working with Canadian officials in speaking with them?
So a point of clarification, it's been reported the patient is a Massachusetts resident, but we are not saying beyond the fact that he's a Massachusetts resident where he is. We are not aware of cases in Canada at this time. We are speaking with the CDC, and they are coordinating with health officials in Canada and elsewhere around the world.
But is this connected to the clusters or cases in Europe?
So at this point, we don't know. I think it's important to know that this is an evolving situation where in the past 2 weeks, we've seen a number of cases without a reported travel history to West Africa, which has been the travel that's been most relevant. So right now, we don't have that travel history. We don't know how the patient acquired this infection, and that's why we're working closely with public health authorities.
So could you help us understand a little bit, because it's potentially a serious viral illness, but then we know that it dissipates after 2 to 4 weeks. Can you help us understand how serious it actually is?
So a couple points here, and again, evolving information. We got confirmation from the CDC this afternoon that this is the West African clade, and that is one that's known to be less severe. Patients can have a real mild illness. This patient, fortunately, is doing quite well now, although had symptoms that required the hospitalization. I think at this point it's important to recognize that we have some available medical countermeasures that the CDC is looking at. So, for example, they'll be looking at post-exposure vaccination as a possible tool. There are also medical countermeasures for treatment for individuals who develop severe illness. But at this point, there's a spectrum of illness. We are, reassured by the fact that this is West African clade, and we'll learn more as we go along.
I'm sure this person is super surprised, as are all of you guys. All of us. Monkeypox seems like a very random, rare illness. Can you talk about the symptoms? It starts with flu-like symptoms, then a rash, and then again, you guys think that this person's going to be okay?
So you had it correct. So the initial symptoms are flu-like, so fever, chills, very non-specific. There is other stuff out there right now, like COVID, and so that could be, confused in this. Now the point really is the epidemiological risk factor, which will be part of any workup. After those fevers and chills, lymphadenopathy or swollen lymph glands, and that's where, at that point, is when the rash develops. Now the rash can proceed over a series of days and even weeks, where they develop either flat or then pustules, and in there is where the virus is. So that's where the direct contact with the fluid is really one of the major risk factors for transmission.
Can it transmit before the lesions appear?
So that is another great question. So what we know to date is when a person is asymptomatic. So for example, someone that has an exposure, they're asymptomatic in that incubation period. Before they develop symptoms, it's thought that they are not infectious. Once the symptoms develop, at least from what we understand understand from our colleagues in public health, and we discussed that with them today, that is the period where the patient is considered infectious. Now, they continue to be infectious for the entire time that those lesions are there until such time as every one of them has scabbed over. At that point, they're considered non-infectious. And there may be additional tests that the Department of Public Health asked us to do at some later date related to that.
And can you clarify for us about this particular patient? Given the fact that there are other flu-like illnesses out there right now, how did this patient report to the hospital knowing that there was going to be an issue broader than flu-like symptoms?
So we obviously can't share any details of the patient's individual condition. I think what we're seeing is that this is an evolving case where we're seeing monkeypox in patients outside of West Africa who have not had a travel history, and it was really an incredibly astute clinical team who thought of this diagnosis as they saw the constellation of the lesions, the rash fitting. So again, although it starts with more vague symptoms of fever and myalgias, the muscle aches, the fact that it has the diagnostic rash, the lymphadenopathy, the lymph nodes, that's really important.
Is there a threat to the public, like this spreading to other people, like an outbreak here in Massachusetts?
Thank you. So I think as Dr. Shenoy and Dr. Bittinger have highlighted, really right now, human-to-human transmission really has occurred through close contact, generally speaking, and that is close contact via respiratory droplets and sort of prolonged face-to-face contact, as well as direct contact through lesions or in direct contact through contaminated bedding or sort of clothing that has been contaminated with the lesions. And so right now, the Massachusetts Department of Public Health is working closely to identify contacts that fit that definition and notify them, as well as exposed healthcare workers within the healthcare system, and to identify them and conduct active surveillance of symptoms. So typically that's the process, and so right now those individuals, our focus is on contacting them, and we'll continue to learn more from this case and all the other global cases that are being identified. Again, I think a key thing that we've learned is to be humble and also to remain vigilant, and that's really what we're asking everyone today, both patients and our healthcare workers. So thank you.
What's MGH doing to notify other healthcare providers about what to watch out for?
So right now, we issued, the DPH issued a press release, and sort of in that press release highlighted a lot of the clinical symptoms to really watch out for. So for example, patients can present, as Dr. Shenoy highlighted, with flu-like illness and other sort of very general fevers, chills, and an unexplained rash and lymphadenopathy. Those are the more classic symptoms. So really elevating knowledge about those, and then also the epidemiological risk factors in accordance with those, right? So thinking about travel to a country where cases have been identified, thinking about close contact with someone who's been diagnosed with monkeypox or suspected to have monkeypox, and then also men who have reported sexual contact with other men. So those are the big three epidemiological risk factors. And so, and really for providers, knowing that when we're seeing patients with an unexplained vesicular rash and that might fit these epidemiological risk factors, to be vigilant and to use the appropriate precautions and the PPE that I mentioned. So I think those are really the big things to focus on.
Are those close contacts being asked to quarantine?
So those close contacts, the typical procedure for close contacts is to ask them to monitor their symptoms. So for healthcare workers, that can even include before reporting to work to ask about fever, chills, rash, and other symptoms for 21 days. And so it really is a very intensive process.
And then one other question for me. I think that this kind of obviously opened all of our eyes when we got this in our inbox. The word monkeypox alone is startling. But then to add this on top of living through 2.5 years of a pandemic, a lot of people are on high alert right now. Can you just speak to that?
Of course. I mean, again, I think it is, we've learned a lot in the past 2 years, and I think those are, for me at the very least as a public health official, to be humble and to remain vigilant and to communicate regularly with the public around what we know are, I think, the three big factors. And so we really will learn more over the next weeks as we learn more about this case and other global cases, and we'll continue to provide that information. And I'll let others, Dr. Bittinger, Dr. Shenoy.
I would emphasize that historically this has been a very rare disease with very rare transmission around the world. What we have seen in the United Kingdom, in Spain, and in Europe has been novel, and that gives us cause for concern. But I think appropriately, people should not be afraid of monkeypox right now. The current patient is of no public health risk right now, and people should just be aware of symptoms, but not be afraid in any way.
The cases in the UK, are they also from West African virus strain?
So we do not know I do not know the clade of those. The clade is a strain of that virus. I'm sorry.
It's just like sort of a mystery right now why this is happening in Europe and not here.
That's correct. I think it's a mystery. But that's why we are working so closely with our colleagues from the Boston Public Health Commission, with the State Health Department, with the CDC.
And then just to bring it back to the traveling to Canada, do we know if that person drove, flew, the contact tracing going that way?
So contact tracing is investigating all the contacts of the patient, but I can't give additional details.